Hello everyone, this is Virginia. Welcome back to my channel. So today I wanted to talk to you guys about the truth about the Korean health insurance system. So today I'm going to mainly focus on just the national health insurance program that is provided for everyone living in Korea, but there are also private insurance companies that you can also add on to supplement if it doesn't cover as much as you're looking for. So for that, I would suggest to kind of do your own research about that. There are multiple companies that you can look into, but today we're going to just be focusing on the national health insurance program. So if you are going to be living in Korea for 6 months or more, you are required to sign up for the national health insurance plan. So the cost is going to be your salary times 7%. So basically 7% of your annual salary. If you work at a normal company, then they're going to cover 50% of that. So basically you would pay 3.5% of your salary towards your health insurance. So it's pretty fair, each person's going to pay the same amount out of their paycheck, and it's really not too much of a burden. If you are an F4, D2, or D4 visa, then you get an additional 50% off of that. So it would be like 50%, and then your employer is paying 50%, so 25%. If you're self-employed, then the calculations are going to be a little bit different. I honestly don't know too much about that. So if you are self-insured, you might want to look on their website or call the call center for more information about the rates you'll be paying, but the coverage will be the same for everyone. So maybe it's because I'm from America, which has one of the worst health insurance programs in the whole world. We actually don't have a national universal healthcare system for people, but I've just really loved the Korean health insurance system, and I think that it's great for like a normal person. It covers most anything. I will say that if you're the type who needs to go to the hospital a lot, then you might benefit from getting a private one on top of it, because you can get some money back for the payments you make. I did do that one while I was a student because they had a really good rate, and I ended up getting a lot of my money back. I think that the one I had paid like 80% back for whatever the national one didn't cover. So I was barely paying anything at that point. So the national health insurance covers an annual examination for you every 2 years, depending on your birth year. So if your birth year is an odd number, then on odd number years, you're going to get your national health insurance health examination. If it's an even number, then on the even number years, you can go get yours. And this is going to be a comprehensive blood test, and it also includes like an eye exam, height and weight, like, the typical things. They check for everything. And basically the purpose of this is just to make sure that they're going to catch any kind of chronic conditions before they get too severe, and so you can treat them earlier. I actually think it's a really good idea that they encourage this kind of health check, because if you prevent these diseases before they get worse, it's actually a lot easier to treat them, and it's much better for the overall health of the society. You can also get cancer screenings depending on your age and your gender. So you can look that up on their website. It kind of depends on how old you are and your gender. So look that up, but that's another way that they're trying to help provide the society with good health coverage so that you can treat all of these things easier before they become too severe. If you become pregnant in Korea, they are going to help you out a lot. As you know, Korea has the lowest birth rate in the world, and so in order to counteract that, they're trying to provide as much help as they can to people who would like to have a baby. So if you become pregnant, then the health insurance will cover up to 1 million of the cost of this baby. It includes the pregnancy and the childbirth. So this is 1 million. It's basically like a cash voucher as far as I understand it, which means even though they're going to cover the normal stuff for that, anything you have to pay out of pocket, you're going to get up to 1 million of that back. And from people I know who have gone through pregnancy in Korea, it actually covered like basically everything that they needed. So you mostly can get pregnant for almost free as far as I know in Korea, but comment below if you have any more information about that, because I'm not 100% sure. So let's talk about how you can use these services. So let's say that you catch a cold. Where I'm from in the States, people just kind of treat it at home because going to the doctor is just such a hassle and so expensive. But in Korea, most people, they get a cough, they're going to the doctor. So there's 3 tiers of doctors. but the bottom ones are basically like your local clinics. So you can just walk into any of these and see a doctor. You can go to a general one, or you can go to a specialist. You don't need to be referred to the specialist, you can just go yourself. So if you have a cold, usually people go to the ENT, which is the ear, nose, and throat doctor, and they're gonna just give you a checkup and tell you what's wrong, and usually they'll give you a prescription for some medicine to help you feel better. You can also go to these clinics for your biannual health examination, depending on the clinic, but most of them do offer this service. So these clinics, you don't need a reservation. You just walk in, give them your name, show them your ID card, and then you just wait to be called. And so this is just going to depend on how busy they are that day. It could be anywhere from like 5 minutes waiting to up to an hour. So it kind of just depends on how busy it is. But I will say, compared to at least in the States, you don't have to make an appointment, and you can just kind of go whenever you feel sick. And the doctors themselves, actually a lot of them speak English because a lot of them actually went to medical school in another country, or I mean, it's a doctor, so they're like the cream of the crop, right? So even if they just studied in Korea, they probably have really high English test scores because they got into such a good program. So most doctors, especially younger ones, will definitely be able to speak English with you, but if not and you don't speak Korean, then just bring Google Translate and that can basically help you out. But they're gonna do a pretty thorough job of checking you out for everything and try to help you. I will say that one of the concerns that some people have about visiting the clinics in Korea is that it can feel a bit more like a factory because they're trying to get through as many people as they can as quickly as they can. So you usually just see the doctor for around 5 minutes or sometimes less depending on your conditions. So it's not going to be as personalized. They're not going to really do much of the small talk unless they're a very friendly doctor. Usually they just kind of like get straight to business, and you go in and then you're done. So after seeing the doctor, they're going to give you the prescription and you're going to just pay for how much it costs. So usually if you have the national health insurance, then a visit to a clinic like this can cost between 5,000 and 20,000 won if you're just meeting the doctor. If they do something like giving you any sort of like vaccines or like other treatments, then of course it will cost a little bit more, but usually they'll warn you about that before you go. So then you're going to take that paper that they give you your prescription on, take that to the pharmacy. There's usually a pharmacy in the same building as the doctor, sometimes literally right next door, and just give it to them. They will give you all the medicine that you need. The prescriptions, it really depends on how many pills, how many days, kind of stuff like that. But I would say it could range between like maybe 20,000 to 80,000 for a 1 week supply of medicine, but it like really depends on how many pills they're giving you and all that kind of stuff. And then the health insurance also covers a dental exam every year, so you can go see the dentist and get scaling, which is like the teeth cleaning service, for free. So you just go to like any dentist you want and it'll automatically be in the system as long as you have signed up for the national health insurance, and then you can go get your teeth cleaned and everything. And it can be free, but sometimes they do charge an extra fee. Like I think I usually pay like 16,000 won for that, but still not too bad. And for that, you do usually make an appointment, but you don't need to. You can just go into any dental clinic you want to and wait. But if you go to one once, then they'll usually ask you to set up like your next appointment, and at that point it's more of like an appointment basis type of thing. So it's slightly different from the other clinics, but similarly, like if you have a dental emergency, you just go right in. Like one time I chipped one of my teeth, I just like went to the nearest dentist and they fixed that within like 10 minutes. So it was really not a problem. Okay, now let's talk about the ER. So in America, you're really not going to call for an ambulance unless you are literally on your deathbed, because it can cost thousands of dollars even for like a 10-minute drive. So obviously, like most people will probably never call an ambulance in their lives if you live in the States, but in Korea, it's quite common. I see ambulances like all the time driving around. So with the ambulance, the ride is actually free. It's covered by NHIS. So if you're on the National Health Insurance Program, then your ambulance ride is free. Then you go to the ER and they'll treat you. They'll do whatever tests they need to do. Now, because it's the ER, it is going to be quite expensive. So I would say, like, I've been there a couple times. It's usually like 200,000 for the visit, especially if it's like at night, because usually the only reason you would go to the ER unless it's an emergency is if all the other clinics are closed. So like if something happens at night, like one time I hurt my toe and orthopedist. Is that the bone doctor? I don't know. They were closed because it was like 9 p.m. or something, so I had to go to the emergency room. Of course, it wasn't like that expensive. I think it was like $50,000 or something, but I'm just saying, like, you know, if you're going to go to the ER, it is going to be more expensive than just going to the local clinic. But that said, they do usually see you pretty quickly, and they're pretty thorough with all the tests and stuff. Usually when you go to the ER, it's going to be a big room with lots of people beside each other on the beds. Sometimes they have curtains to separate you. It basically looks like if you've seen a Korean drama, it looks like that. But let's just say that the people in the rooms all by themselves, that's probably for the rich people. So if you're rich, then I guess you get your own room. But for most people, we're kind of like all in the same area with the curtains in between. And they do provide you with meals depending on how long you're there. And the meal is actually quite yummy, at least in my opinion. I can't remember exactly what it was, but it was like, it kind of looked like a Korean school lunch meal on like the little tray. So highly recommend that. And speaking of the tests, like let's say you need to do an MRI. I've done that before, and I think it was like close to 200,000 won, which is expensive, but if you're comparing it to other countries, then this can vary. If you're from like Europe or somewhere with free universal healthcare, then obviously it's gonna be really expensive in your opinion, but as an American, it's like so affordable to get it for only 200,000 won. So yeah, just I would say that what I've noticed from Korean doctors is that they really want to help the patients as much as they can and figure out what exactly is wrong with them so they know how to treat them properly. They're not going to do like, oh, we're not sure, it's probably this, so you know, you probably don't need to worry about it. Usually they take it quite seriously and do a lot of tests just to make sure that they rule out anything really serious. One of the other concerns that some people have with visiting the doctor in Korea is that they do tend to overprescribe medications compared to other countries. So, for example, I've been given antibiotics like just for having a cold. So, where I'm from, usually antibiotics are for like serious infections. So that was a bit of a culture shock, but let me know in the comments if that's the same in your country or how you guys treat getting medical prescriptions. And then I did want to mention about the larger university hospitals. So these are the ones that have the specialists, like not the ENT, but like neurologist or cancer doctors, things like that. Those are going to be in the university hospitals, and so these ones you do need to be referred there from your local clinic or doctor. And so you're going to make an appointment there, and then you can go, and they usually can like take your blood test there, do any other tests that you're going to be needing depending on your situation, and then you meet with the doctors. So you will need to make appointments to visit the university hospitals. They're also much more expensive, and so usually that's like a last resort, kind of like the ER, just because it's more expensive. And so if you don't need to go, then I would recommend try to do it at your local clinic before you end up going to the university hospital. Just price wise, it just makes more sense to go to the local one. Also, since there's not quite as many of the larger university hospitals, you might have to go farther away, whereas like the local ones could be like in the building right beside where you live. So that's just my opinion on that. Alright, so this is my experience with the Korean health insurance system, and so I would love to hear what you guys think about it. Have you lived in Korea and tried the health insurance? What do you think about it? Or in your home country, what kind of things are different from how we do it here in Korea? Just let me know, and let me know in the comments if you have any more questions. I've lived here for 8 years, so I've kind of done the whole system of health insurance stuff. So just let me know anything you want to know, and I'll try to help you guys. And make sure to subscribe, and I'll see you guys next time. Thanks for watching. Bye!